Dr. Vuong, if I ask you about TMJ and the big long word TMJ, there's no way for me to pronounce it, so you'll do that for me, please. But basically, it's the hinges here, which are out of alignment due to a variety of things. That could be a car accident, that could be teeth grown badly from the beginning, that could be having missing teeth for too long. All kinds of reasons why that could happen. It could even be bang, somebody, whacked you once. However, you dentists can fix that, because when people have TMJ, headaches, muscle, neck tensions, even back pain, lower back pain could possibly be happening from it, and yet a dentist can fix it. Headaches, migraine headaches. Tell us about it. Tell us how you can fix it. What is all involved?
Well, TMD is actually a temporal mandibular disorder, and it has to do with the jaw joint right here being misaligned, and every time we open and close, there's a disc there that kind of slides on slides off the joint when we open, and then slides back on the joint when we close, and that can cause a lot of pain and discomfort and headaches and muscle aches and so on and so forth.
I've heard that joint, that particular joint here, that joint is one of the most most complicated joints in the whole body, because it's kind of three-dimensional. It moves in all directions, versus the shoulder or whatever doesn't do that. Is that true?
Yeah, that is definitely true. It is one of the most complex joints and one of the most complex disorders. Makes fixing it is sometimes challenging.
And it fell on the shoulders of the dentist.
Definitely, the dentist is kind of like the primary care doctor for the TMD.
So what's TMJ and TMD? Is there a difference?
The difference is TMJ is the actual joint itself, the temporal mandibular joint. Okay. TMD is temporal mandibular disorder. So if you have a problem with the joint, it's TMD.
Okay, I got it. All right.
Yeah.
Good. So how does a dentist, being the primary caretaker there, how does he fix it? And if he's the primary, that implies to me that there are perhaps some other ones also there. Can you shed some light on the whole thing? Give us the lowdown.
Sure. Definitely. Dentist is we're just one of many healthcare professionals that can diagnose and treat the TMJ disorders. The other ones that do that are oral surgeons and
still
massage
dentist
therapists.
Which one?
Right. Massage therapists.
Okay. Wow. Okay.
And also chiropractors. They do a great job of treating TMJ.
Okay. Can they treat it alone or in cooperation with a dentist?
Oh no, definitely in cooperation with the dentist.
I got it.
Because the dentist is actually treating the joint itself, while the chiropractor is making adjustments to the muscles of the back and the spine, because all of that is affected from this being out of line.
I got it. So basically, the joint is out of line. It gets everything back. Or you have your headaches, you have your back pain, your shoulder pain, and you have that for too long. All those muscles and maybe even the spine is somewhere not aligned anymore, needs some relaxation, needs some treatment, and that now falls on the shoulders of a massage therapist or a chiropractor.
That's absolutely correct.
Okay, I got it. So it's a little bit like if your ball bearing in a car doesn't work, your tires get out of alignment, so somebody needs to fix the ball bearing, but you still need to change the tire.
That's correct. That's correct.
All right. Okay. I'm getting it. All right. So what is, give me a major, one of the more common ways of treating a DMD. a disorder in the joint?
The first step is evaluating the joint, making sure that the problem is coming from the joint. Sometimes the treatment can be as simple as a simple tooth adjustment. Sometimes you have one tooth that's misaligned. Maybe it's tipped over a certain degree or kind of super erupted, grown out in a certain position. And that's causing the whole jaw to be misaligned. And a simple adjustment to a few teeth or just even one tooth can fix the problem. Another solution would be, and the most common solution is a TMJ splint, which is a piece of plastic kind of shaped like a mouth guard. So we wear this at night so that when a lot of patients that have this TMD problem, they grind their teeth a lot at night, and when they do that, they actually hurt their joint up here, and all their muscles get all achy. And so the splint actually helps prevent the muscles from getting fatigued, and also prevents the disc from slipping in the joint.
Got it. So it looks like the treatment, well, I mean, it may be complicated and precise from the viewpoint of a dentist. Of course it is. It looks like that we're dealing here with millimeters, maybe even fractions of a millimeter in terms of adjustments. And I'm sure it's not that easy. But in terms of the patient, at least it's not bloody. It's not like major surgery or something like that, it looks like.
No, the first few steps of the treatment, which I would say fixes the problem for a majority of the patients, has no blood or no surgery involved whatsoever.
Good. Well, all right. Good. Well, here we go. So a dentist can fix those problems. So basically, whether it comes from missing teeth, from having a car accident, for teeth grinding, which comes from stress, all kinds of reasons why your jaws might get misaligned. I know all about misalignments from cogwheels and stuff, having been in the mechanical machinery engineer field for a while. You sometimes don't know why it happened, but whatever, it's not even so important. What's important is to find that it is misaligned and then align it. And hopefully, yes, you find out the why to a very degree, because otherwise it usually gets out of alignment again. So I might have, said something slightly wrong there. It doesn't matter why it happened, because the why will work it out again sometimes. But the point is, fix it, get it going. And so sometimes, be it a chiropractor or a massage therapist or something like that can, fix that, again. All right. Well, wonderful. Thank you very much, for shedding some light. So there is hope. People with headache, shoulder pain, back pain, if it hasn't gotten fixed with whatever traditional treatment they tried, even if they tried the chiropractor might not have looked into those jars and fixed them. Yes, is that about what it is?
Yes, definitely. You summed it up perfectly.
Well, wonderful. Thank you very much, Dr. Vuong.
Thank you, Helmut.